Welcome to another episode of Bailiwick Podcasts. I'm Jodie Ettram, and today we're diving into an issue that's been making headlines in Jersey: PFAS in our water supply. You may have heard of these so-called forever chemicals, but what exactly are they? Why do they matter? And how concerned should we be? To help break it all down, I'm joined by Dr Steve Hajioff, chair of the independent panel of experts who are looking into PFAS contamination. We'll explore how PFAS got into Jersey's water, what the risks are, and what's been done to address the problem. Hi Steve, thank you so much for being here today. Please could you start off by telling us a little bit about yourself and your background?
So, well, firstly, hi, and lovely to meet you. I'm a doctor. I have been for nearly 40 years now, and that sounds like such a long time. But as well as being a doctor, I trained as a director of public health, and I have done a lot of work around the interface between science and policy. So I've worked for the World Health Organization and the World Bank. About a dozen governments around the world, for London, the Greater London Authority, and for the National Institute of Health and Care Excellence, which is the body in the UK that produces clinical guidelines that help doctors do the best things for their patients. So there's a lot of that stuff, as well as the seeing patients, which I did for 30 odd years, and also being a director of public health in an area that has two major international airports and several chemical plants. So environment and health has been on my agenda for quite a long time.
Perfect, thank you. And now currently you're looking into PFAS and you're helping to advise the Jersey government as part of an expert panel. But before we get into that, I'd just like to start off with the basics really surrounding PFAS. For anyone who's just hearing about it, what exactly is it and why is it a concern?
So PFAS is an abbreviation for, and my apologies for the very, very long words, per and polyfluoroalkyl substances. Now, this is a group of about 10,000 different chemicals that are really, really useful. And that's why they've been manufactured for more than half a century now, because they do things that other chemicals don't necessarily do. So they're really good at waterproofing. They're really good at making foam. There's actually, you'll have heard of an antidepressant called Prozac. Well, that's a PFAS. One of the most common anesthetics that's been used over the past several years is halothane, and that's a PFAS. So there's a wide range of things that they are useful for. But we started getting a bit concerned over the past couple of decades for two reasons. Firstly, because they hang around in the environment a really long time. The thing that makes them useful is that they don't break down very easily, so you can use them in manufacturing really difficult things. But it also makes them problematic because it means that when they're in the environment, they'll stay there a long time. The second issue is what they do in the human body, and they stay a very, very long time in the human body. And certainly particularly the longer chain ones, which are the ones that we'll be talking about a bit more, the ones that are relevant or particularly relevant in Jersey at the moment. And some of them can stay in your body for, it takes, half-life is how long it takes to go down to half the level in your body. And some of them have a half-life of 10 or 12 years. So it's not like you take something that's not good for you and it's actually flushed out of your body in 6 or 8 hours, which is what happens with most things. With some of the PFAS, it's there for years and years and years. And as we've discovered, that there is a risk of them doing harm over the past few years, that becomes a real worry, because you've got something that's potentially harmful to you, and it's in your body for a decade. Well, maybe even longer than a decade, because if the levels are high, you need more than one half-life to get the levels down to low. If that makes sense, it needs to halve and then halve again and then halve again. So that's the root of the problem, really. Mm-hmm. And I think it's really important. I guess one of the things I want to add is PFAS are a problem in every single part of this world. Every country has been exposed to PFAS, and I think it's really important that Jersey is one of the first countries that have actually really taking it seriously, and are really working to understand PFAS and understand what can be done to minimise any risks. I can only think of about 4 other countries that have got there first, if you like, out of 200 countries in the world, and I think that's a really important thing to say.
And you mentioned that these chemicals have a risk of doing harm to the body. Can you please elaborate a little bit on what exactly it's been linked to?
So this is a little bit complicated, because how can I put this? There are some poisons that are really, really nasty, some chemicals that are really, really nasty, and they do something devastating, and they do it really quickly. Well, PFAS aren't really in that category. It takes them quite a long time often to cause harm, and some of those harms are quite subtle. That means that and because of that, it means that science takes a longer while to catch up with reality than otherwise it would. So it's an emerging area, and what we have is we've got bits of science that say such and such might be a problem. We've got bits of science that are more convincing, that say actually we're pretty sure that such and such is a problem. So, for example, we're pretty sure at this stage that PFAS increase your cholesterol. Now, high cholesterol is not a disease, but it's a problem because high cholesterol might lead to an increased risk of heart disease or stroke. And clearly we want to avoid that. It's pretty clear at this stage, it seems pretty clear at this stage, that PFAS have potentially increased kidney cancer and testicular cancer. Now, they're both pretty rare cancers, so increasing the risk by about 20% actually doesn't make for big numbers, particularly in a small country. But nevertheless, it's a risk people don't want, and quite rightly don't want. It also, they also potentially are associated with an increased risk of high blood pressure in pregnancy, or a condition called preeclampsia, which can be quite serious for mum and for baby, where blood pressure goes up and there's protein in the urine, etc. It's a problematic condition, and that evidence is reasonable. There are 2 other areas where the evidence is reasonable, but we don't necessarily know how meaningful it is in terms of people's health. So it's pretty convincing that the enzymes that we measure to check on the liver's health can be slightly elevated in people who've been exposed to PFAS. But overwhelmingly, they're not elevated to a level that's outside the normal range. So it's difficult to say whether it means anything or not. And there is also, perhaps the strongest evidence, is around the way children produce antibodies after they've had a vaccine. And children who've been PFAS exposed produce fewer antibodies after the vaccine. Interestingly, adults, that's not true of adults. With adult vaccines, there was some research done on COVID vaccines, and it made no difference at all. But the problem is, we don't know that lower antibodies means less protection. it's logical, and it certainly means that PFAS are interfering with the immune system, and that's not something we want to happen. But we don't know that it means more infections. And actually, if you look at the bigger studies, we don't see more infections in PFAS exposed children than we do in non-PFAS exposed children. That doesn't mean it's not a problem. It just means we haven't found it yet. And then there are lots and lots of other things that could be associated with PFAS. So we know, for example, that PFOA, which is one of the types of PFAS, thankfully, that's not at very high level in Jersey. We know that probably causes cancer. That's the World Health Organization have ruled that in July. Now, if something causes cancer, it tends not to just cause one sort. It tends to cause cancer in general. So there is a possibility that PFAS are associated with other cancers as well. But it hasn't been seen yet because those cancers are pretty rare. It probably doesn't increase the risk of common cancers, probably, because we'd have seen it. If it did, you've got big studies that looked at tens of thousands of people, and if it increased the risk of, prostate cancer, it would have shown up in the evidence. And there are all sorts of other things where there's some evidence, but it's not really strong enough. So diabetes, for example, bladder cancer, for example, and lots and lots of other things where there could be an association, but the science isn't yet sufficiently conclusive, if that makes sense. Mm-hmm. My apologies for taking quite so long, but it is a really complicated picture. But certainly we need to be vigilant around testicular and kidney cancers and around high cholesterol and high blood pressure in pregnancy, but we're already vigilant about that, if that makes sense.
Yeah, 100%. And there are a group of residents in Jersey who live nearby the airport in St. Peter, and they are concerned they've been overexposed to these chemicals and that they might be more likely to experience some of these adverse health conditions. I wonder if you could explain a little bit about how the PFAS ended up getting into this area and getting into these residents' bodies.
So the primary sort of route of exposure in Jersey, so PFAS used to be used for all sorts of things. So they were if you go back 20 or 30 years, they were in food packaging, they were in waterproofing materials and spray, all sorts of things like that. And they were also used a lot in what the jargon name is aqueous film forming foam. That's not easy to say. So these are basically a certain sort of spray that firefighters use in order to put out difficult to put out fires. So we're thinking about where there's fuel involved and that sort of thing. And that was a common use of these PFAS, and that's a major part of the issue in Jersey, in that airports have to run fire tests repeatedly. So that the firefighters are good enough to actually deal with an emergency when it happens. So they were setting fires and putting foam on the fires in an area where that foam was running off and getting into people's borehole water supplies. So that's where the sort of original major exposure came from. And there are other routes of exposure. There's PFAS in the sea that comes from all over the world from all sorts of other processes, and that gets into fish and other food. But that's not the primary. This is the primary situation. Now, luckily, actually, people noticed foam coming out of their taps 20 odd years ago. And it was decided to move them from their borehole supplies onto mains water, which really ended the high level exposure for most of those people. And that is really fortunate, because if you look at other places where firefighting foams have got into the water supply, they didn't realise until much, much later. So I think it was 2007 where those homes were put on mains water. In Rönnebo in Sweden, I think it was 2020 or 2022 when actually when the PFAS contaminated water wasn't given to people anymore. Mm-hmm. So there is, I mean, Jersey was ahead of the game even then in that regard. But of course, at that point, we didn't really know the risks. So that's the sort of route of exposure in that area that we call the plume area. And people are quite understandably very, very concerned. They have health effects that they attribute to being exposed to PFAS. They are worried that they have exposed their children to PFAS, what the psychologists will call a moral injury. They feel this guilt, and that's harmful to that's traumatizing for people to feel that way. And so even if they haven't had physical harm from PFAS, which I'm not saying is the case, I'm sure that has happened to some people. But even if they haven't, they have been wounded, if you like, by this situation. And it's another reason why it's really important to take their concerns seriously and to take the issue seriously. And one of the things we do as a panel is we hear from affected islanders on every report we do. We call them, I think quite rightly, experts by experience, because they have lived experience of being exposed to PFAS and having health issues, or of trying ways to reduce the PFAS in their body. And that experience is really important for us in writing our reports, in making things appropriate to the context that's affecting islanders, if that makes sense.
And so this panel that you are chair of, obviously, you've mentioned you've been speaking to affected residents, but why exactly was this set up, and what is the panel exactly trying to achieve?
So the Department of Public Health made the choice in 2022 to offer blood testing to people who lived in what we call the plume area, that part of St Juan's, or who had spent a lot of time there, etc., and who also had symptoms of illnesses that might be associated with PFAS. And that blood testing was done in 2022, and it showed that some people did have quite high levels of PFAS in their blood. And in response to that, it was decided to commission a panel that was about to produce 5 reports. But our focus really is about, what are the risks? What potential harms might have been done? What can we do to minimise those harms by helping get PFAS out of people's bodies? What can we do to minimise those harms to help get PFAS out of the environment? And so that's what we were commissioned to do. We were commissioned to do 5 reports. The first one was an interim one on what's called therapeutic phlebotomy, so taking blood in order to get PFAS out of the body. And the reason why that was first, A, because some islanders had asked for that to happen first, and B, because it's something that's relatively quick to get up and running. So there might be a way, something that people could have access to while we did our more detailed deliberations on everything else. Our second report was on PFAS and health, and the discussion we had earlier about what illnesses are associated with PFAS, that came out of that report. The report we're working on at the moment is about testing for PFAS itself in people, testing for potential complications of PFAS exposure in people, and treatments that might reduce the PFAS in people's bodies, and we'll come to that, I know. And then the fourth report, which we start on formally on Thursday, is on PFAS in the environment and how to reduce PFAS there. There's a fifth report, which is an update on the other four. Now, it was envisaged that would happen straight afterwards. Actually, we, the panel, have said it needs to be delayed just simply because the science is moving fast, but it's not moving that fast. And we don't want to waste people's time by sort of deliberating and looking at the literature again and then turning around 6 months later and saying, yeah, but nothing's really changed. So we want to allow there to be a little bit more time before we go down that road, if it's necessary. Our job is to be forward-looking. Mm-hmm. We are about solutions, if you like. I understand that people are quite rightly concerned about how we got here. But that's not our expertise, and that's not our remit. Our remit is about making things better for the future.
The subject of one of your reports I'm quite interested to ask you more about, which was treatment. So what can be done to lower PFAS in the bodies of the affected residents? So I just wanted to ask, what different treatment options has the panel looked at? One of them was bloodletting, but what else was considered?
So we've looked at all of the treatments that have been researched in the world, and we've got a report that we're drafting at the moment. So how can I put this? We haven't finished drafting it, and it hasn't been looked at by islanders to take their input. So everything I say is just is interim, if you like, on the subject. The treatments we looked at are phlebotomy, bloodletting, plasma donation, which is a bit like bloodletting, but they only take the liquid part of the blood, the plasma, and put the blood cells back in effect. We've looked at dialysis, hemodialysis, which is a treatment that's used for kidney disease. It's a fairly drastic thing to have to go through, but nevertheless there was some research on that. We've looked at a drug that's a treatment for gout, an old treatment for gout called probenecid, which it turns out doesn't work at all, but nevertheless we've looked at it. We've looked a little bit at dietary changes. That's a little bit more complicated because we know that people, for example, who eat more fibre have slightly lower PFAS than people who don't. But what we don't know is whether adding fibre makes a difference, whether people eat lots of fruits and vegetables have lower PFAS because they eat fewer other things that have higher PFAS in them, etc. So we don't know that, but we looked at that. And finally, we've looked at a class of medicine called bile acid sequestrants. And my apologies for the horrible label. Now, these are the first drugs that we had to lower cholesterol in people's body. This is what we were using when I was at medical school, which really ages me. And the only one that was available then was this nasty powder that you mix into a gel, and it's the most disgusting thing to drink. And there's much better ones now that are tablets, etc. But we've looked at those, and what's interesting is they do seem, from what we've seen of the evidence so far, to lower PFAS the quickest. And they seem to have the fewest side effects, which is really, really interesting because, look, bloodletting, we know that's, so phlebotomy, we know that's not necessarily the most pleasant procedure. And it only really makes a pretty small difference. You're talking about, now I'm trying to remember from report 1, but I think about a 4% reduction in the PFAS in your body from each time you give blood. Mm-hmm. And you can only do it every 2 or 3 months because it wouldn't be safe to do it more frequently. So it takes a very long time. You're talking about at least a couple of years to get a major decrease in your PFAS levels. And whilst plasma donation is slightly quicker, it's also a bit more invasive. And it's mostly quicker because you can do it more frequently because you're not taking out the red blood cells. But and hemodialysis, it's much too much to put a person through, to be frank. it's a major disruption to people's lives, and it's still not as fast working as these tablets, these bilated sequestrants. So I think that's really interesting, and I think what's great, to my mind, about what we're doing is that head-to-head comparison between them. Between the different interventions, the different treatments, I'm not aware of anyone else having done that in the world. And we didn't only look at how effective they are and what side effects they have. We also looked at how cost effective they are, how much it costs to halve the PFAS in your body with all the different treatments. And so we compared them on that basis as well, which again I think is groundbreaking. And the tablets are roughly 10 times as effective as any of the other treatment. Well, actually 100 times more than some of them, but that's massive. The dietary changes, yes, I think it's wise. I would recommend anyone to eat more fruits and vegetables and to be on a high fibre diet. And it may well help PFAS. It will certainly help your cholesterol, and it will help all sorts of other things. It will reduce your bowel cancer risk and all those other diseases that are associated with not eating enough fruits and vegetables. So absolutely, that's something that we could recommend. And we could also potentially recommend that people try probiotics, which are they're supplements that are designed to make the bugs in your gut more healthy. Because there is similar evidence that might be associated with a reduction in PFAS, and it probably makes people feel better. Anyway, and that's something people might want to consider. But in terms of treatments, from what we've seen so far, the tablets, the bile acid sequestrants tablets, do seem to be the most effective.
And how long do they take to be effective? How many tablets would you need to take over what period of time?
I don't remember off the top of my head how many tablets you take a day. I think it's like half a dozen. It's not just one pill. You have to take a few of the newest one, which is called Colocevalam, which is the one that has the least side effects. Also happens to be the most expensive, but that doesn't matter so much in this context. Now, in order to halve the PFAS, which is the type of PFAS that's the highest in people's bodies in that plume area, taking the bile acid sequestrants every day, it would take about 7 months to get the level halved. Mm-hmm. So that's reasonably quick compared to others. If we're looking at the total PFAS in the body, it takes a little bit longer to halve them all. We've chosen the PFHXS because that's the hardest one to reduce, if that makes sense. So we've chosen that for the comparator. But we're talking about months, not years. Mm-hmm. And with almost all of the other treatments, we're talking years. Hemodialysis is also months, but it's months of a very invasive procedure with serious risks to health. So it's not, how can I put this? It's not a major life change over a long period. It's potentially a fairly quick intervention.
And you mentioned that side effects, this was sort of the least severe, the tablets you're recommending, but are there any that people should be concerned about at all?
Well, and the primary side effect, and we haven't formally recommended anything yet, the ones that look the best so far on the basis of our research, the most common side effect is constipation, which is, well, a high fibre diet might help with that. There are interventions that can help with that. Now, any pill can have what we call idiosyncratic effects. So you could be allergic to it, or there could be things that it doesn't cause in most people, but it does cause in people. So you've always got to be careful. You've always got to be vigilant. But the most common side effect is constipation.
And just moving on from talking about treatment to more sort of the prevention and testing side, do you think that we should be testing more widely across the island?
So that's something that we're still looking at, that we discussed already. Now, it's slightly unusual that in Jersey, the only people who were tested in that plume area were people who already had symptoms. Just from international comparisons, I think pretty much everywhere else they've tested everyone in the plume area. And so that's one group that we are discussing whether it's appropriate to test them. I think to offer them testing. I think there's another group, which is people who actually have worked on a day-to-day basis with those firefighting foams. Because with what we call occupational exposure. And so we've also looked at that group as to whether it's appropriate to test them, because even if they don't live in the plume area, because they were handling it every day and breathing in the spray from the foam, they might well have some elevated PFAS in their bodies. The final question is everyone else. People outside the plume area, and that's a difficult one. We've talked to subject matter experts from around the world. As part of our process, we invite people who've been involved in the major research projects in different countries, or who are work for regulators in different countries, or are the chief medical officers of municipalities and things like that. And we've heard from lots and lots of those throughout the 3 reports so far. Now, I think it's about 9 subject matter experts we spoke to on this report. None of them felt that blood testing in areas where we don't know that it's high in the water, or there's other sort of experience, none of them thought that it was an appropriate thing to do. Now, that they don't make decisions for us, we make our own decisions, and we haven't ruled anything out at this stage. But I think what they say does have some value. That said, we really do need to know what the average levels are in different parts of Jersey. We already recommended in our report 1 that there should be an anonymous testing to work out average levels, across the island. And I think we're going to reiterate that with a bit more detail, because it would be really useful to know the average levels by parish.
Another question I wanted to ask was about the concern that's been raised, which is about whether PFAS contamination is affecting our food. So, for example, maybe crops that were grown in the plume area, like our Jersey Royals or something like that. How would you respond to those concerns, and how concerned are you personally?
So, firstly, just picking up the Jersey Royals first, this concern was raised with us the latter part of last year. And so we did do some work outside our normal work programme, just supporting various officers in the environment team and in public health on how they might want to test that. And the good news is that what was found in Jersey Royals is comparable to the European average. So just to cover that particular issue, because I know it is a worry for people, both in terms of their exposure, but also in terms of their livelihoods. Mm-hmm. And it's one of the reasons why we offered the advice and support outside our normal process, because we could understand quite how important it was to islanders. In Report 4, which is the one we're starting next Thursday, we are looking at PFAS in the environment. And environment doesn't just mean land. It means water, it means food, it means potentially air, although that's probably not an issue. And we will be looking at different foodstuffs and what the levels of PFAS are, how that potentially contributes to the body burden, to the amount of PFAS in people's bodies, and how that compares to other places. Probably the European average, but we haven't decided that yet, so I don't want to jump the gun. We need to actually have that debate as a panel. We're also going to look at agricultural practices and how that might impact on PFAS levels in food and in groundwater and things like that. So we're going to look at agricultural practices because there is potentially an effect on the content of PFAS in food and also in groundwater. So we'll look at the use of slurries that might contain PFAS, or the use of sea vegetables that might contain PFAS as fertilizer. We'll look at the use of groundwater for irrigation. That might contain PFAS, particularly in the plume area. And all of that will be part of our consideration in Report 4. We're going to, because of the level of concern that's been expressed by islanders and government, actually, and Jersey Water, we're going to look at mains water first in Report 4. So our first months will be focused on what we believe appropriate levels, safe levels in water should be, and what the best technologies are to get there. So we'll focus on that first, and we'll be coming to food and agricultural practices just a little bit further down the line. But we will be looking across the whole of the potential exposure spectrum. We're going to look at sea foams and sea sprays as well, and all sorts of other things, so that overall we can give a coherent picture of where people are at risk of exposure and what can be done to reduce or eliminate those risks.
And just moving back to speak about the water supply, so you did mention about, with the next report, you're going to be looking at how much PFAS is in the main supply and also whether sort of international standards are appropriate. Now, apologies if this question is a bit premature before you've done all your research, but is there much PFAS in our mains water, or is it only sort of trace amounts? Do you have a view on that yet?
So we haven't formally looked. Now, it's certainly within UK and EU guidance from what we've seen and from what we've been told. And clearly there's more sampling that needs to be done. It doesn't look like it's, how can I put this, scary like it has been in some places 20 years ago. It looks like it's in the levels are in a reasonable ballpark, but the science has moved on. A lot of the international safe levels were set on the basis of the effect of PFAS on the immune system, and that was before we knew that PFOA, one of the sorts of PFAS, can cause cancer. Because that was only announced in July of 2024. And most of the water regulations internationally were set long before that. I would expect most of the world to be revising their water regulations on the basis of that additional bit of information. Because your risk tolerance for something that potentially causes cancer being a sometimes irreversible outcome, is fundamentally different from something that makes your immune system behave slightly differently, but probably reversibly. I think it's a moving target, and our job has to be to aim for where the target's going to be. 5-10 years from now, when everyone has taken that into account, rather than aiming for where it currently is in nearby countries. That is usually quite a sensible approach. I think in this particular instance, it's not the best approach anymore. As to where we suggest that safe levels are, I just don't know. That's something we really need to do a lot of work on. But there is one thing that actually is very much, again, in Jersey's favour. Because of the way the water system is organised in Jersey, other than those households, and there's a couple of thousand of them, so it's not a small problem, other than those households that are on borehole supplies, you would only need to treat the water in the 2 water treatment plants in order to get the levels lower for the overwhelming majority of islanders. And that's that is how can I put this? That's a problem that every other country in the world would be deeply jealous of, because to do the same in the UK, where everything is mixed after it's been through treatment plants, would be an absolute nightmare to deliver. So Jersey, once again, can be more fleet of foot than a lot of other countries can, which is great.
And just back talking about the international regulations, so Jersey Water, I think, says 99.95% or something of their samples meet standards, and then some campaigners on the other side have argued that, these standards don't go far enough. Would your response to that basically be, we'll be looking at that and even before standards internationally change locally, and we're going to try and be ahead of the game, essentially? Is that something you'd say to them?
Yeah, I mean, that's exactly what I was getting at about aiming at a moving target. Want aim for where standards are likely to be internationally 5 or 10 years from now. It would be foolish not to. And we've already seen the US changing their standards very markedly in response to the International Association for Research in Cancer. That's the bit of the World Health Organization that said PFOA causes cancer or can cause cancer. And in response to that, they changed their regulations quite markedly. They're the only country I'm aware of that's changed their regulations in that light. I would expect most other countries to follow suit. And so that's where we need to aim. And to their credit, we've already had some preliminary discussions with Dirty Water and with ministers and all sorts of stakeholders. And I don't think anyone has pushed back at any point. So there does seem to be a willingness to aim for where the target's going to be and to do it right now rather than to do it okay now and have to do it again in 5 years' time.
And for those people who might be listening to this who are still feeling concerned about this, and even if they might not live in the plume area, they're really concerned about this issue, what would you say to them?
Look, it's really, really difficult because anything I say about risks being low, etc., is going to be unhelpful. It's not going to help them because the way we feel risk as individuals doesn't necessarily relate to how big the risk is. Yeah. How much control we've got over the risk is much more important. And water is the stuff of life. You need water, and it's not in your control. So any reassurance that I offer is not going to be necessarily helpful. And just to illustrate that sort of risk perception versus actual risk, every now and then I would, when I was in clinical practice, one of my patients would come to me and say, "I'm absolutely terrified of flying. I need some help, with my fear of flying." But that person was a smoker, and their risk from the cigarettes that they were choosing to smoke, the risk to their life, was thousands of times, maybe even millions of times, I don't know, greater than their risks from going in an aeroplane. But that didn't make any difference to how they felt and what their perception was. And I think we just need to be mindful of that rather than just throwing figures out at people. That said, the risk from PFAS is much, much lower than the risks from other things that are potentially in the environment. And just as importantly, the lead time, if you like, the time it takes for those risks potentially to manifest in a person is often many, many years. So a few months or a couple of years between current water levels and lower water levels is not likely to have a great effect on the risk that people experience. Now, that's all irrelevant because the risk that they perceive is not going to change, and what they feel, quite understandably, is, why am I being exposed right now? And all we can do is support people and understand that they have an absolute right to feel the way they feel. That doesn't mean that anyone else is wrong, but it does mean that they have a right to be concerned about a risk, even if that risk is a small one. That makes sense?
Yeah, it makes perfect sense. I think that's a really, really important point, and it's important to validate these people's concerns, which are entirely valid. But I'm also very pleased that we've got a whole panel of experts sort of looking into this and producing all these reports that are available to us. But if people sort of want to learn more about your work or maybe have a look at the evidence themselves, where exactly should they go to find it?
So the reports, as we publish them, are available through the PFAS website at gov.je. I don't know the URL off the top of my head, but the reports are there. Every report that we produce contains the minutes of every single meeting that we had in coming to that report, and it also contains what I call the Islander input section. So every comment that we receive from people on the draft report is anonymised and put in a table at the back of the final report, along with our response. Now, we don't always make the changes that are asked for, but if we don't, we make a point of explaining why we don't think that's the right thing to do. So all of that is there. The minutes of all of our meetings and the papers for all of our meetings are also available online. And I guess the other thing that I perhaps should have mentioned from the very beginning is that part of the choice we made when we were, as we were being recruited actually, was that we will only work as long as our meetings are in public. We want people to be able to actually sit and watch our meetings, listen to our meetings, and see what we're saying and why we're saying that in real time. And I think they're also available for download or for streaming later. Because, well, for a whole variety of reasons. Because I don't think we have a right to be closeted away in a dark room. I think that would be unhelpful. Because sunlight is the best disinfectant, metaphorically speaking, not literally. Literally, there are much better disinfectants. I think it's really important for establishing and maintaining trust that everything we do is public. Now, there are little bits that we do in private. So, for example, if we're talking to someone about their own health problems, it's important that we respect their clinical confidentiality. And I guess potentially, and this hasn't happened yet, but potentially if we're talking to a business about a particular issue that's going to affect their business, I don't know if it's a farm that's using certain practices, etc., it would be commercially harmful for them to have that conversation in public. So we would do that in private. But then even in that situation, there'll be minutes of that meeting that say what was discussed, just anonymised. So I think that is part of it. One of our recommendations in our last report 2, was a summary of the potential health impacts of PFAS and it was originally conceived as a sort of a handbook for GPs and other healthcare professionals in Jersey so that they could help support the people they look after who are concerned. But it's just as useful to anyone. I would also recommend reading our reports because, and I would say this, wouldn't I? we go into quite a lot of detail about the methodology that we've used. The problem with science is quite often a scientific paper doesn't actually mean what it claims to mean. And there's a whole skill set that's actually been most of my career about being able to delve into the underlying meaning of the science, particularly where it's not what the people who wrote that study think it is. And that's what we're doing. It's called critical appraisal of the literature. And that is explained in detail in the introductions to our reports. Likewise, how risk works is explained in detail in the introductions to our reports. And those things, I think, will be really useful tools. Even if people don't like what we say, they'll be really useful tools for people to familiarise themselves with, so that when they look at the science from other sources, they know how to ask the right questions, if that makes sense. Because there are always, on every issue, there are people out there who have got a vested interest in promoting a viewpoint. And that can be really scary for people. And so I think it's really important, we think it's really important that people have the tools that when they look at such and such a website from America and the information that is offered there, they can actually say, oh, hold on, but that's what it says, but they haven't answered that question, if that makes sense. And I'm hopeful that will just help people in taking more control over their situation, because that all helps reduce people's feelings of worry and anxiety.
Mm-hmm. Thank you so much, Steve. That was absolutely fascinating. Thank you so much for breaking everything down in such an accessible way for those who aren't so much science experts. I really appreciate it. And thank you so much for your time.
It was an absolute pleasure and lovely to talk with you.
Thank you for listening to Bailiwick Podcasts. This episode was brought to you by Bailiwick Express and the Jersey Evening Post. If you enjoyed it, make sure to subscribe to wherever you get your podcasts so you don't miss the next episode. Thanks again for listening.